This slide deck has been created for the Benjamin Court Campaign Group to provide important information for the public and residents of North Norfolk, outlining the background and history to Benjamin Court and its potential role that it might play as a neighbourhood health hub for residents in the future. The slides deck sets out the Labour government's new NHS 10-year plan priorities and provides the background and history to the closure of Benjamin Court, sharing film evidence from campaigners available to the public about the important role that Benjamin Court could play to support the population health challenges of residents of North Norfolk in the future. It outlines some of the estimated costs associated with the model of social care currently offered by Norfolk County Council and Norfolk and Waveney Integrated Care Board, and how Benjamin Court could provide the neighbourhood health service for the future. This year, the Labour government launched its new 10-year health plan for England to ensure that the NHS is fit for future. It aims to provide more accessible and integrated health and social care within local communities. There are three big shifts to how the NHS works. They foresee that it's important to move from a hospital to a community model of care, with more care being delivered and available on people's doorsteps and in their own homes. Moving from analogue to digital so that we embrace new technology, which will free staff up from their administrative roles and allow people to manage their care as easily as they bank or shop online. And moving us from a sickness to a health prevention model so that we can get to people earlier to enable them to make healthy choices, the easy choice in terms of their lifestyle and quality of life. So the NHS plan is to promote a preventative neighbourhood health service model so that it can be delivered as locally as it can, digitally by default, in a person's home where possible, in a neighbourhood health centre or health hub when needed, and only in a hospital if absolutely necessary. In order to deliver this, it needs the NHS and social care to work together to prevent people spending unnecessary time in hospital or in care homes if you are elderly. And it aims to do that by strengthening primary and community-based care so that people can receive care close to, at home or in their place of work. And in order to do that, it aims to connect people to accessing health and social care, to wider public services and third sector support, which includes social care, public health and other local government services. In 1993, the NHS opened Benjamin Court and provided 36 community beds, including post-hospital rehabilitation beds. This was closed by the NHS in 2017 and taken over by Norfolk County Council, which opened 18 beds offering a 6-week reablement service, therapy and support to enable people to get fit enough and well enough to return home and live independently. This model helped to reduce hospital overcrowding and bed blocking in our local acute hospitals and optimise contact time for paid carers. It also helped to save travel time for relatives going backwards and forwards to our 3 large acute hospitals to see their loved ones and reduced hospital readmission rates. Evidence showed that it enabled people to return home safely and stay out of hospital and avoided costly and unsuitable care home beds. Despite its value to the local community of North Norfolk, Benjamin Court was closed in June 2023 with no public consultation. Since then, the facility has been left empty, with social care bosses instead putting extra funding into reablement treatment in the community, and there is very little evidence to show that that replacement model has been beneficial for recipients of the services. As a result of the closure, the Benjamin Court Campaign Group was formed, and this film that you can watch by following this link tells you the background to what's happened to Benjamin Court since its closure and what the campaign group have proposed in a wide range of high-profile activities. The Benjamin Court Campaign Group, made up of passionate local residents, have campaigned vigorously since the closure of Benjamin Court, and in collaboration with Tim Adams, our North Norfolk District Council leader, and our local MP Steph Aquarone, they've built a cross-regional coalition of support. They've challenged the Norfolk and Waveney Integrated Care Board in public meetings and sent a series of letters to their chief executive, as well as ensuring that Healthwatch Norfolk were commissioned by the ICB to conduct a public survey into the future of Benjamin Court and its potential uses and value as a community asset. They've campaigned vigorously through radio, interviews, news articles, and hold regular campaign meetings to build support and raise public awareness across our region. They've developed a number of public films and resources, the links to which are in this slide deck. They've also submitted an application for Benjamin Court to be seen as an asset of community value, which prevents it being sold by the NHS, and ensured that our MP Steph Aquarone presented the case to Prime Minister's Question Times in Parliament in June of this year. Most recently, they also ensured that the case was raised at Norfolk County Council Adult Social Care and Public Select Committee to have the decision to close the service overturned. This slide gives you an opportunity to listen to the Norfolk County Council Adult Social Care and Public Health Select Committee meeting, which was held on the 14th of July, in which they debated the value of Benjamin Court as a neighbourhood health hub in the future to residents of North Norfolk. The case was presented by Steph Aquarone, our local MP, and Tim Adams, the North Norfolk District Council leader. The Select Committee concluded that the decision to close Benjamin Court in June 2023 without any public consultation contravened the Local Government Act 1999 Section 3, which states that proper consultation has to take place with those that use the service or are likely to use the service. Councillor Brian Watkins states that the decision to close Benjamin Court was both misguided and will turn out to be a false economy for the council. Following the meeting, the North Norfolk News presented a news article saying that there's a glimmer of hope for the service as a coastal centre, and that councillors have agreed to explore the options as they stand today, looking at how they might enhance integrated working with the NHS, and that Benjamin Court may well provide an answer to addressing some of the population health issues in the future. So why is Benjamin Court so important as a resource to the residents of North Norfolk? North Norfolk is ageing faster than any other part of England, and we have a big care time bomb. And if we don't address this in the next couple of years, proactively using the resources that we currently have in our local communities and making them fit for future purpose, then we are going to have a very serious health challenges on our hands. And we already know that the services that we have locally are stretched to beyond capacity. If we look at the evidence from Professor Sir Chris Whitty's Health in an Ageing Society report published in 2023, he identifies that in the past decade, the proportion of people aged 65 and over has increased, and more than 25% of the county's population are now aged over 65 years. And that trend is expected to continue, with projections suggesting that by 2040 we'll see an increase of 55% in people aged 75 and over. Most of Norfolk's population increase will be in the older age groups, with those aged over 65 years increasing by 82,000. North Norfolk has an older population compared to other areas, with a third of the population aged over 65 years. And because of the population growth and an increasing number of people living here in later life, there will be even more demand for appointments at doctors, dentists and hospitals, a rise in emergency admissions, and more people living with complex long-term conditions. And if nothing changes, the demand for appointments across Norfolk and Waveney over the next 5 years will increase by more than 1,000 appointments a day. This expansion in the older population is likely to move very quickly over the next 10 years, as you can see here, particularly in relation to women over the ages of 65. But equally in men over the ages of 55. In addition to the increasingly ageing population with more complex health needs, we're also going to have a big gap in the number of carers who are available to offer health and social care support. So as the population ages, as this slide shows, there will be less people available to provide the care needed. And that is in part because more people are retiring from health and social care professions. It's also because young people are not interested or not going into health and social care careers. And in coastal communities, there are less people available to undertake health and social care jobs. In his 2021 report, Professor Sir Chris Whitty identified that if the health problems of coastal communities are not tackled vigorously and systematically, there will be a long tail of preventable ill health, which will get worse as current populations age. Currently, 1 in 3 patients admitted to hospital as an emergency have 5 or more health conditions, which is up 1 in 10 over a decade ago, as identified by the National Institute for Health Research. The Minister for Health in 2023 said up to 20% of hospital admissions are avoidable with the right care in place. By expanding the care provided in the community, the most vulnerable, frail and older patients can be better supported to continue to live independently or recover at home. 40% of people delayed in hospital nationally are awaiting a social care package, and 14,000 hospital beds in England are occupied by a person who's medically fit for discharge, which is accounting for around 13% of occupied beds, which is up by 1/3 on pre-pandemic levels, according to the Department of Health and Social Care in 2023. National length of stay data, which is available, shows that the average length of stay in general acute hospitals increased by 18% between April 21 and October 22, with more than 6,000 patients spending longer than a week in hospital compared to pre-pandemic levels. The length of stay has also significantly increased, as we know, in mental health inpatient care, which reflects an increased acuity and challenges around discharge, with 20% of all people staying for more than 60 days, at an average cost of £400 per day per bed. On average, around 24% of patients with delayed discharge are awaiting the start of a home-based care package, 16% awaiting residential or nursing home placements, and 24% are awaiting intermediate care beds. So that's something a bit like the step-down facility that Benjamin Court provided. Nationally, the real economic argument for the cost of delayed discharge is one around flow. That is the flow interruption of patients being able to be admitted, move through and discharged from hospital, because flow interruption means that ambulances can't actually release patients from the back of an ambulance and they sit outside an emergency department and stack up, as we've regularly seen on the news during the winter season in particular. Nationally, in 2023 to 2024, there were almost 450,000 delayed transfers of care, which represented 13.66% of all hospital discharges, which cost the NHS an estimated additional £1.7 billion, according to the King's Fund. Delays in releasing older patients, in particular following hospital treatment, cost the NHS £820 million in 2016, according to the National Audit Office, and this is the most recent figures that we have available. The National Audit Office also estimated that care in more appropriate settings, either in a person's home or in a local reablement centre in a local community, would cost closer to 180 million, which would make a significant saving to the NHS per year. This slide, provided by the Department of Health and Social Care, shows current constraints on patients' flow through acute hospital settings in England and is a simplified picture of accident and emergency patient flow. So you can see that people can attend an emergency department either to see a minor injuries clinic or because of a major accident or requirement for urgent treatment, emergency treatment. And that will depend very much on the A&E department's capacity to be able to see the patient at that time. That will lead to an emergency admission to a ward, an inpatient hospital department, or to same-day emergency care. And then patients are discharged either home with no care package or discharged to social care or community care. The key driver for performance is high occupancy, with difficulty discharging patients, in particular to social and community settings, which results in an increased length of stay and knock-on difficulties admitting patients to hospital. According to data supplied by the Nuffield Trust and the Health Foundation, the reasons for delayed discharge from hospital are displayed on this slide. So for patients waiting 7 days, it's usually because there is no plan or further assessment needed, which represents 36% of all patients who are delayed. 18% are awaiting home or community care, 15% awaiting a short-term bed, and 12% awaiting a bed in a nursing or care home. For patients who are waiting longer than 21 days, those statistics vary slightly, with 31% with no plan or further assessment needed, 16% have other reasons, 17% are awaiting home or community care, 18% a short-term bed, and there's none available, and 17% awaiting a bed in a nursing or care home. From analysis of data provided by Norfolk and Waveney Integrated Care Board that's reported to NHS England, we can see that Norfolk and Waveney are about average for England delayed days, which is about 6 days per person. However, this discharge data reported between October 24 and March 2025 shows that across the 3 acute hospitals that we have in our region, the total bed days lost because of delayed discharge across our region was between 5,200 and roughly 6,600 total bed days lost. If Benjamin Court Hospital is successfully reopened, it can become a vital neighbourhood health hub for the residents of North Norfolk. Some ideas around this could include step-up care to help people avoid actually needing to go into hospital in the first place. It could also provide very important respite, convalescent and palliative care for people who require support locally, avoiding hospital bed blocking. It can also continue to provide the reablement programme for step-down care with the 6-week programme that it offered previously. It has a whole raft of therapy rooms that could be used for therapy clinics, well-being opportunities, mental health support, day cafes and day centres for mental health support groups, local charities such as Dementia UK, Age UK, and of course day centres to reduce social isolation and loneliness in people who are perhaps living on their own. Most importantly, for local families, it could provide really important opportunities to learn how to cook with their children, for kids to go to day clubs and day centres. The opportunities are absolutely endless. As we move forward into a public consultation, we hope that Norfolk County Council will take the opportunity to hold a meaningful public consultation across health and social care with Norfolk and Waveney ICB very seriously indeed, and give you the much needed opportunity to enable your voice to be heard as to how this important community asset could become one of real central value to the residents of North Norfolk in the future. Thank you very much for your attention.